Hi, I'm Mike Dilk and you're listening to the Relax Back UK show, the show that explores all kinds of health topics relevant to you, your family and your friends. Each week I talk to expert guests from a range of backgrounds to inform and entertain you. So please do join the Relax Back UK family and stay tuned.
Hi, thank you for joining me, and I hope you're doing well. Now the new year is well underway. This Relax Back UK episode looks at some predictions for the next year and how some things might progress. I chat to Laurie Smith, head of Foresight research at Nesta, about lots of topics, including digital intelligence. Have we just had enough of social media? Are young people turning away from it? To can the massive amount of health information now captured on digital devices be useful for us as individuals or others?
But then it can get blurry as well because there's explicit health data, for example, knowing my heart rate or whether I've got a particular disease. But there's other things that from which you can infer health data, because if you know what food I buy at the shop, my supermarket might know that through my club card or loyalty card of some other sort. You can actually infer things about people's health, even though it's not specifically health data as such.
We then chat about other topics and how they will develop in the future, including AI, energy, and more specifically, energy islands.
What they can do is they can bring together energy from multiple wind farms and transport it more efficiently to the shore. They also allow wind farms to be further out to sea, which means you get more steady wind, which means you get more steady power.
And then some of my thoughts on transport in the future. So please do stay tuned for a great show. Now, before that, if you want to know about the future and the present as far as your health is concerned, let me remind you of my book recently published. It's called Cut the Crap, Ask the Questions That Matter About Your Health. And it draws on the experts that have been on the Relax Back UK show to answer many health questions, and also helps the reader to ask their own health questions that are particularly relevant to them. Again, it's called Cut the Crap, Ask the Questions That Matter About Your Health, and it's available on Amazon and Kindle. So the guest is Laurie Smith. He's head of Foresight research at Nesta, and I started off with some of my thoughts on what he gets up to.
My goodness, what a fabulous job. I mean, what do? Do you just sort of dream up what might happen in the future?
Well, there's an element of that to it, but our work's a bit more sort of evidence-based than that. So we do think about the future, and we often use sort of systematic sort of techniques to do that in a sort of structured way. So rather than just dreaming things up from nowhere, we'll use sort of particular methodologies that sort of called Foresight techniques. We'll often we sort of generally base our thoughts on evidence from the present and the past to sort of extrapolate trends that might go in the future. And there's elements of that are qualitative. So it might be finding out what experts think about a topic. There's elements of that are quantitative. So, for example, some of my colleagues do sort of data-driven horizon scanning, where they use artificial intelligence to look at huge data sets to understand where innovation might be going down the line.
Yeah, so I was a bit rude when I said dream up. I didn't really mean dream up, actually. I did assume that this was done in a sort of a scientific and logical, sensible manner, really. And that I guess that didn't just come across in my comment. But either way, it does sound like great fun. And how on earth did you get into that? What do you have to be able to sort of predict with data and with sense the future?
Well, I suppose the way I sort of came into this, I didn't this one way into sort of the sort of profession of foresight. I sort of came into this, my background is sort of science and technology policy. So I sort of studied a combination of science and social science many, many years ago at university. And then I suppose science and technology have increasingly impacted on our lives. So digital technologies, health technologies. And I spent quite a lot of my career working at various national academies in the UK, and they operate a little bit like think tanks and can advise often the government on what particular scientific developments there might be. So there's a social element and there's a sort of scientific element. And then through that, I got more into sort of emerging technologies. So what's the stuff that's really, really at the cutting edge? And then sort of moved into a job at Nesta, sort of looking at principally that sort of thing. Though also I look at social trends as well.
Okay. Fantastic. All right. Well, I've got some areas that I'm keen to kind of quiz you about. So hopefully all and they cover kind of all of those things, I think, really. So first of all, digital intelligence and the digital world, which could mean almost anything. But I did a bit of a straw poll this morning. My daughter, who's 20, had a party last night, and some of the guests were still here this morning, as is kind of the way as kind of late teenage parties. So I asked them what they thought about social media, because I knew I was going to be talking to you, and the answers kind of surprised me. It was generally, actually, we're getting a bit fed up with social media. I'm going to just bin it. I'm going to stop social media. So, and recently, Twitter is full of kind of racists and loons. So, are people not taking social media seriously anymore? And has its day done of young people just fed up with it all?
Well, I think my understanding, we didn't look at these. So I work for Nesta, which is an innovation agency, and the work we've done recently is around sort of signals, which are sort of showing sort of data points and trends, and sort of showing the what we think the future might look like. And we didn't happen to look at social media this year, but my understanding is that there are moves towards smaller social groups, equivalent to things like WhatsApp. So it is social, but you might have a group of 50 people as opposed to broadcasting to hundreds and hundreds of people. And I think the platforms are changing as well. So maybe 15, 20 years ago, it might principally have been, say, Facebook, and now maybe younger people especially might use things like sort of Instagram. But I think there's sort of growing concern about social media, particularly for young people, for young women, and its sort of potential impact on mental health. I think Australia has introduced some laws, some quite tight restrictions on the use of phones, which is sort of one way into social media over the last sort of year or so. And I think there's some people calling for that to happen in the UK as well. And I suppose parents are left with this challenge, aren't they, whereby they often get phones in part because all their children's friends have phones. But they might not. No one might want phones. So we're all sort of forced into buying phones, even though we might not want them. Though different people have different views on the topic.
So that was interesting. The Australian thing. Was it an age of 16? You have to be 16 before you can partake in some social media.
Yeah, I think some is allowed and some's not. I think certain things like YouTube are allowed, and others things that aren't. But other countries, it wouldn't surprise me. Other countries followed suit. I mean, it's not something we've looked at in great depth. But I suppose a digital technology we have looked at is sort of digital parenting and what tools there are to help parents. Parents get stressed and anxious, and there are things like
I've got some specific questions about that, which I want to ask you. But first of all, just staying on the kind of digital thing. First of all, we will come back to the AI because I think that's fascinating. But on the kind of digital intelligence and digital health. Now, for Christmas, I got an exercise watch, and I'm wearing it right now. And I've really enjoyed kind of playing with my new toy, and I've been doing some skipping and looking at how my heart is and that sort of thing. I've been analysing sleep. Is that actually going to be more useful? Because it's quite fun for me, but can that sort of technology be expanded to be sort of a bit more useful for the whole population?
Well, I suppose the question is, there's sort of two ways to think about it. One is there's an interesting idea that exists called virtual wards, which we wrote about in our signals last year, where rather than patients have to go into hospital to be monitored, some of that can be done from home. So you can use similar sorts of technologies, which will save time for patients. Maybe if the patient's disabled, it might be easier so they don't have to go in. It could save time for doctors and clinicians as well. So there's an opportunity there. I suppose the question about whether, say, your watch will help is it depends on, does it result in behavior change? So just because you know how much glucose you're eating or whatever, do you change your behavior as a result? Which I think sort of trickier, because sometimes people might do that, but other times if they just look at the numbers and don't do anything, then their health seems unlikely to improve.
Yeah, no, that's interesting. And it's already had a bit of a knock-on effect as far as sleep. So wake up in the morning, my wife says, "Good morning, dear. Did you sleep well?" And I'll say, "I don't know," and have a look at the watch. But obviously, I do know how well I sleep because it's how, because you wake up and it's how you feel. So in some instances, maybe you take your eye off the ball, something, because you kind of look at the watch to see how well you slept rather than thinking, well, actually, I know how well I slept. I don't know.
Yeah, and I suppose it depends what you're looking at. So I suppose with sleep, you can know that. And I suppose you're using, I don't know a great deal about it, but you're using presumably sort of proxy indicators. Well, other things where we sort of understand the relationship with health a bit better. For example, say something like blood pressure. It's quite difficult to know your blood pressure without it being tested.
Yes.
So that could be a useful thing to monitor. Or say heart rate, where there's people have a clear understanding that, the relationship between heart, more clear link between the relationship between heart rate and health, and you might not notice so much your heart rate as you would say the amount of sleep you're having.
Yeah. What there's a slightly bigger question here, which I haven't really heard many people talk about. It's the sort of thing you guys may well have thought about. If lots of people have these sorts of watches, there is a massive amount of data somewhere. Now, this massive amount of data could be used for good, very much good, but it could also be used for slightly nefarious things. Insurance companies would love to get hold of that amount of data somehow. Now, what's happening to all that data? Does anyone know? Is anyone using it for good or for evil?
Well, I don't know about evil, but I think it's being used for different purposes. Depends on sort of who the data is. I know the NHS, for example, very strictly regulates data. There was a report a couple of years ago called the Goldacre Review, where they sort of said we should only be able to access data in a very sort of particular way and particularly secure environments. So it'd be useful for research because you might be able to go, all right, I can see patterns of disease or whether some particular treatments can work. And that sort of thing could be useful for, say, something like COVID. But then also sometimes companies are sort of taking that data, and I suppose it depends on what terms and conditions you might sign up to. I suppose sometimes, maybe a bit too often, people sort of go yes, yes, yes to all the terms and conditions, and it might be they're using that data for something. Though I think health data tends to be more strictly regulated than other forms of data. But then it can get blurry as well because there's explicit health data, for example, knowing my heart rate or whether I've got particular disease. But there's other things from which you can infer health data, because if you know what food I buy at the shop, my supermarket might know that through my club card or loyalty card of some other sort. You can actually infer things about people's health, even though it's not specifically health data as such.
Yes.
So often people can be sort of giving away what's health data without necessarily even knowing.
Yes, very, very interesting. And I never read the small print. I just tick so I can use these things. And there's, and with these cars you get at supermarkets as well, I just tick. So there's a lot of information about me somewhere, which someone could collate if they felt so inclined for whatever reason. That's probably another whole series of shows, actually. So maybe the best thing to do is to move on to kind of the next topic. And you touched on it already. It's more detailed sort of digital intelligence, moving on to AI, because a while ago everyone was talking about AI. They still are, and there's some various interesting aspects of health and AI, I think. And you touched on one, actually. You started to talk about health and parenting and AI before I kind of cut you off. So what was it you wanted to say about that?
Yeah, so I suppose one of the signals we picked up on was around sort of digital parenting tools that provide AI, that provides advice on parenting for parents who might be sort of stressed or anxious. So examples of this include Dr. Becky Kennedy's Good Inside app. There's Emily Osler's, who's an economist and parenting expert. She's got the Dewey app. And that can provide sort of useful sort of advice to parents. There's some challenges with that as well. Because some of those can be expensive, and so it might not be accessible to, say, parents who've got less lower incomes. So we think there's an opportunity for, say, local authorities or health visitors to help direct parents when they're looking at the sea of apps towards ones that might be free or ones might be a bit more affordable.
But what do they do? I mean, what do they do? What do these apps actually do? If you're a parent with, say, an unruly child, or any child, what can an app do for you?
Well, you can ask for advice on how to deal with, say, tantrums or helping children sort of go to bed or on health matters. So a lot of these apps draw on the research and the work of the experts. So with Dr. Becky Kennedy's work, it sort of all draws on that. And then, so I suppose it's almost like having a health guru in your pocket who can sort of help with sort of bedtime battles and tantrums and things.
I get it. So it's a source of information.
Yeah.
All right. So when I heard about this AI and parenting, I thought it might be a bit more sophisticated, and I immediately went off along the, and you can tell me if this is possible or it's been done already, but I was thinking, say if you've got a child who has problems with eating, an eating disorder, which is not that uncommon, there may be some signs in behavior or pulse or temperature, meaning that if all those things coincide, a child is potentially more likely to eat at that moment. So you could very cleverly or carefully collate that information, then an alarm goes off, ping, everything's happened, your child might be more likely to eat now, so try and feed them.
Right.
That was just a crazy thing that popped into my head. I mean, does that sound completely nuts or within the realms of possibility?
So I don't know about that for that particular application. I'm aware there are predictive analytics that can see sort of correlations between data and make those sorts of predictions. I don't think my understanding is they're not perfect, but that they can be used. I don't know if it's been used for that sort of particular purpose, but that sort of thing does exist. I'm not sure if it's been done for parenting though.
Okay, all right.
But the value of these tools is that you can sort of interact with them. So rather than just have a textbook or a website where the information is, presented as long pages, you can just ask it a question and say, oh, well, what do I do in this situation? And then it'll come back with an answer because of the digital technology, it knows how to speak with you.
Yeah, all right, that's interesting. What about digital interactive AI technology? I was talking to someone earlier today and they said, well, what about interactive adverts? Now, on the tube, I'm amazed how often I see adverts for supplements, are you feeling tired or whatever, or that sort of thing. So if you were to walk past one of those adverts and it could detect who you were and whether you were sort of shuffling along as opposed to having a spring in your step, the advert might say, hey, Mike, are you tired? Why don't you try this, whatever it is?
Mm-hmm. Well, I think the technology is getting there. So there are gait analysis technologies which can, we did a signal about this a few years ago where it can look at the way in which people walk and tell who they are. So the technology exists. And I think another signal we did some time ago was around adverts that react to people. I'm not aware of one that actually exists that does that. And maybe there are sort of strict regulations around it, because I suppose there's you can't necessarily just put up security cameras wherever you like. The public might object to being spied upon.
I think so, yeah.
In principle, you might be able to start doing it, but I don't think anyone has at scale, to my knowledge.
Okay, interesting. All right, so as far as the AI and help for parenting, that's the kind of, it's provision of information, really, like a lot of information in your pocket.
Yes, yeah, exactly. But that can be really helpful because there can often be stigma around asking for help. And also sometimes parents can be isolated. And I suppose there's sort of research that shows that 98% of parents with under threes have mobile phones and have Wi-Fi. So I suppose they're like to be able to get sort of hold of sort of digital information. It can also be scaled as well, because I suppose a challenge with, say, people like health visitors is you have to that can be quite expensive, and you only got a certain number of people to do that. But I suppose with digital technologies, you can reproduce them across phones millions and millions of times. Now, I can't imagine an app will be as good as a health visitor, but it might be a sort of a practical second best option when you can't have a health visitor there all the time.
Yeah, sure. All right. So that's health of people. Let's move on this very quick gaze into the future. Health of the planet. Now, there's talk at the moment, or this phrase, energy island, has cropped up, and how this is going to solve energy problems. All right, so I don't really have much idea what an energy island. What is an energy island?
So an energy island,
when will they exist, and what do they do?
So an energy island is something that might be around the sea. It's an artificial island located far out at sea, might be about the size of the Tower of London. And what they do typically is, I suppose, act as hubs for offshore wind. And the world's first energy island is going to have its foundations laid off the coast of Belgium next year. And what they can do is they can bring together a sort of energy from multiple wind farms and transport it more efficiently to the shore. And they also allow wind farms to be further out to sea, which means you get more steady wind, which means you get more steady power. And the final thing they do is they allow trading of energy between different countries. So let's say Britain has an energy island and Belgium has one, but it might be it's windy in the British waters, but not windy in the Belgian waters, so we can sell some of our power to the Belgians and vice versa. Though at the moment, no one has any energy islands. It's only the Belgians who are actually building one.
All right. So actually, it's a better way of using existing technology. It's not really some new technology. It's using wind farms which exist already, but in a slightly more efficient way. Is that fair to say?
Yeah, well, I suppose we have to sort of build the artificial islands, but often it's often true for technologies. As technologies often are combinations of other technologies. It's
Yeah.
very rare that technology springs out of thin air and isn't related to all the previous technologies. You often have this that's improved, there's a slight improvement on that. You very rarely jump to something completely different.
Okay. Actually, in a previous life, I'm a civil engineer. I was a civil, you never really stop being a civil engineer. So I would imagine you'd be better off having an energy island that floats, rather than kind of is stuck to the seabed. What are they going to be in the future? What's the one that's currently been built?
What they're planning to build is actually ones that are stuck to the seabed. I think they plan to do it in the North Sea, which is relatively shallow. I think there is also separately attempts to look at there are separately floating wind farms, as well as sort of different from energy islands. But the proposals for energy island that I'm aware of are ones that are actually stuck to the seabed.
Okay. And is any of the energy that's going to be produced and funneled into these energy islands going to be made from anything other than windmills, essentially? What about wave power? We got anything that's going to get energy from the waves feeding into these?
Well, there aren't plans for that at the moment, though in principle you could also do that. I think wind technology is ahead of wave technology, so and their sort of efficiency has been improving quite dramatically over the last few years. So I think that's been the sort of focus to date. But I don't see why in principle you couldn't have wave technology as well.
Okay. All right. Well, I'll invite you back next year and we'll have a chat about the energy thing. Right. So maybe we've covered health, energy. The other thing that affects so many people, transport. Yeah. And so for years, actually, I've got into your game of trying to predict the future. And so far, every time I've been wrong. So you're probably best not offering me a job. But my prediction has been transport, how personal electric transportation devices would just take off, and everyone would be using them, and that doesn't really seem to be the case yet. I'm thinking, electric unicycles, electric roller skates, apart from the obvious, electric scooters and electric bikes, hoverboards, all this kind of stuff. And I really had a feeling, and I still think they're going to become more and more popular and indeed useful. Have you had any thoughts on that? For in cities and busy places and elsewhere, actually.
So we haven't looked at electric transport. I'm aware that, but I think we are seeing it. You can see, as you said, the sort of electric bikes. And I think there's lots of regulations against them, aren't there? So I think lots of them are actually illegal, certainly in the UK.
Yeah, electric scooters, unless you rent one from a scheme, you're almost certainly breaking the law. Yeah.
So the sort of regulatory issues. I suppose you could see in principle how it might be better to have people going around on, say, scooters or electric personal transport than in cars, because you get less damage from collision. Because suppose you're only on a small scooter rather than a sort of big car, you get less air pollution, because at least in principle you can power it using sort of sustainable power. It's presumably cheaper and uses fewer resources to make those as well. So I can see sort of a case for them, but I don't think anyone's quite cracked it yet. I'm not aware of any city where everyone's going around on electric unicycles yet.
Well, so I mean, thinking about London, the roads and the pavements, they're just not designed for it yet, really, are they? And then you think, okay, so should these people whizzing around on these electric, whatever they are, unicycles or scooters, should they go with the pedestrians or should they go with the cars? And that's not an easy
separate them all out. Maybe there could be a thing of, I don't know, this isn't something I've sort of looked at in great depth, but maybe a starting point is, rather than jumping straight to electric vehicles, let's work out how we can allow bike transport from sort of A to B. Because obviously at the moment, People, I think sometimes people can be afraid of sort of cycling around because they're close to cars. Well, in other countries, I think in the Netherlands and in Germany, bikes are separated from cars and pedestrians in lots of places. So actually, we've got an existing technology that can allow people to travel faster, that we know works really well. It's more environmentally friendly, is healthier, but we're not deploying it as much as we can because we sort of need to change the infrastructure a bit.
So, all right, so there's a lot going on. We've looked at some health things, some energy things, a little bit of transport. So these, presumably, these are things, well, the ones that as far as AI and digital wellness, what have you, you've been looking at for the last few months to kind of predict the next year. What are you starting to look at now? Because presumably this sort of work takes a long time. So what this time next year, what are you going to be talking about?
All right, well, it's so hard to know. I think there's some interesting stuff around time officers and sort of managing how people use time. I think Barcelona has done something on those lines, which I think could be interesting. And there's something interesting around autonomous AI agents. So rather than just have an AI that you chat to yourself, you can have one that can be given some instructions, goes off and does something for you, and then comes back to you again. I think there's lots of interest there. So there are a couple of examples of interesting developments that might happen in the next year. But what we usually do with our signals is build up a long list over the year and then start making some choices around about the autumn as to which we think will be most exciting.
Yeah, fantastic. All right. Well, I think your line of work sounds absolutely fascinating. Essentially, great fun. So thank you for coming to chat a bit today. If people are listening and they like to sort of gaze into the future, where's a good place for them to get some thoughts? I mean, what sources can people use to help with this kind of idea of crystal ball gazing?
Well, there's a Nesta website. So if you go to www.nesta.org.uk, it's the organisation I work at. I work in a team called Discovery, and our job is to look at sort of cutting edge innovations and technologies. So hopefully that'll be a good starting point.
Excellent. All right, that sounds like I'm going to be looking at that website, I think, in the next few weeks. So, look, Laurie, thank you very much indeed for taking the time to chat. Much appreciated.
Thank you for your time.
Thank you very much to my guest, Laurie Smith, Head of Foresight Research at Nesta. Thank you to you for listening. I hope you enjoyed thinking about the future year. Please do remember to check out my book based on the experts that have been on the Relax Back UK show over the years. It is called Cut the Crap, Ask the Questions That Matter About Your Health, and it's available on Amazon and Kindle. And remember to have a healthy week. Until next week.
Thanks for listening to the Relax Back UK show. Join me, Mike Dilk, again next week for more fascinating interviews and chat. If you're listening to the podcast version, please subscribe, like, and share it with your family and friends. And have a healthy week. Until next week.